Dr. Sanjay Gupta's documentary series We takes an in-depth look at marijuana's potential as conventional medicine. Now, the very first FDA-approved drug derived from marijuana is available by prescription here in the United States. So, is this a turning point? Sanjay joins us now with all the details. It seems like a big deal, Sanjay.
I think it is a big deal, and it's interesting, John, because typically, you have science comes first, and then you see the cultural impact of that, you see the social impact. Here you've had a situation where culturally, socially, legally at the state level, people have been voting on using marijuana as a medicine, but now you have the FDA actually approving this medication and making it available. Here's how it happened.
In 2013, I first realized the possibility of marijuana as a medicine when I met Charlotte and her mother, Paige.
It's okay, baby.
This is Charlotte in the throes of a seizure. Nothing made them stop until they tried CBD, a compound found in cannabis.
I measured it with a syringe and squirted it under her tongue. She didn't have a seizure that day. And then she didn't have a seizure that night. I just thought, this is insane.
It worked for Charlotte and so many other children. But at the time, parents were forced to concoct the medicine in their kitchen sinks, unsure of the dosing or the purity.
Okay, so we just add more oil then, or we add more weed?
Good parents who would do anything to try and help their children. Like John and Donna. Their daughter, Jonna, named after both of them, also had unstoppable seizures since she was a year old.
They did not give us a lot of hope, for her future.
At one point, doctors even told them to start looking for hospice care.
We wound up moving over her neurological care over to NYU because they were doing the cannabis oil study at the time, and we wanted to participate in that.
That cannabis oil study was the beginning of the Epidiolex trial for treatment-resistant epilepsy. Dr. Orrin Davinsky oversaw the trial at NYU.
Some of these kids right now who their lives were completely transformed. They went from having hundreds of small seizures a day, kind of sitting in a wheelchair slumped over with almost no interaction with the environment, to being seizure-free. Their lives were transformed.
From the first time we had an EEG recording at CHONY that showed she was having over 100 seizures a day, the last EEG we did with NYU showed one seizure over a 24-hour period.
Dr. Davinsky will be the first to tell you Epidiolex is not a miracle drug. Far from it. While some have had dramatic improvements, others had no improvement at all. And there is the pesky fact that cannabis is still considered an illegal substance by the United States government.
It's my view that the use of marijuana is detrimental.
In fact, the company making Epidiolex is not based in the United States, but in the UK.
Wow, this is pretty spectacular.
Dr. Jeffrey Guy is the founder and chairman of GW Pharmaceuticals, the makers of Epidiolex. I visited their labs outside London. This is where they turned the plant into a medicine.
We're able to say what each individual cannabinoid does. We can then breed into the plant the materials that will provide us with a range of beneficial effects.
The price tag for all that? $32,500 a year. So far, Jonna has been receiving the medication through a clinical trial. Her parents hope insurance will cover the cost going forward.
I think everyone who has a child with significant medical needs is always hoping for a miracle. But in lieu of that, I think we just want her to keep, moving and making steady progress as she has been.
So, Sanjay, do you think this approval by the FDA validates the science behind marijuana as medicine?
Yes. I think absolutely, and that's been a big point of friction. I think many in the medical community over the last 5 years have started to be increasingly persuaded that marijuana, that cannabis can be a medicine. I think now that you have, this is the first, I want to reemphasize this, there's been other synthesized drugs that come from synthesized molecules from cannabis. This is the plant itself, John, that has been distilled down into a medicine. So it's a plant-based medicine, and it's gone through the FDA approval process, clinical trial process, and is now available. I think that's very validating. I don't know what it means for the plant as a whole. It's still an illegal substance, but I think to your question, the science has validated this.
Dr. Sanjay Gupta, you've been at the forefront of this discussion for the last several years. Thanks so much for being with us.
Yeah, thank you.